welcome to A Sound Constitution here on CHLY 101.7 FM, a show where we focus on health topics important to our community. This year's team is made up of 8 third-year VIU nursing students. Our goal is to demystify health issues and address common misconceptions by sharing evidence-informed information from a variety of reliable resources. All information provided on our show will be available in our show notes on our Facebook and Instagram pages. We want to remind our listeners that the information presented in the show is for educational purposes only and does not replace the advice of your primary healthcare professionals. If you have any questions or concerns about what's being discussed, feel free to reach out to us on Facebook at A Sound Constitution, Instagram at CHLY A Sound Constitution, Twitter at ASC_VIU, or email us at asoundconstitution@gmail.com. We would like to start off our episode by acknowledging that we are on the unceded territory of the CMAJ people, with a broadcasting range that overlaps the Kwatsan and Sliammon territories. This acknowledgement is done with gratitude to the CMAJ people and with the intention to increase awareness about truth and reconciliation processes and efforts on Vancouver Island. Additional information and resources surrounding CMAJ history, reconciliation, protocol, and land acknowledgement can be found on our Facebook, Instagram, and YouTube pages. Hi, I'm Cassidy, your host for this week's episode, and I'm here with my co-hosts Ashley, Tyler, and Ashley. This week's episode is focused on nurse practitioners. We will be looking at their scope of practice, how you can go about accessing one, their role in the BC healthcare system, and the educational pathways to becoming a nurse practitioner. Our episode will include a TED Talk from Derek Yock addressing the importance of health promotion and disease prevention in our healthcare system. Later on, we will also include a short segment from the Lippincott Nursing Center, talking a bit about the history of nurse practitioners and their impact on the healthcare system. For this episode, my co-host Ashley and I will be interviewing a nurse practitioner from the Nanaimo community, speaking with her about her experience of becoming a nurse practitioner and what her roles and responsibilities look like in our community. We will be covering the different practice opportunities available to NPs, their scope of practice, as well as the difference between nurse practitioners, general practitioners, and registered nurses. She will also be sharing advice for any listeners who might want to look into seeing a nurse practitioner in the future or might be interested in pursuing a career as an NP. So before we dive into our interview, I'd like to hand it over to my co-host Ashley, who is going to give us a quick rundown of what a nurse practitioner is for any of our listeners who might be new to the term.
Did you know nurse practitioners are healthcare professionals who have achieved the advanced nursing practice competencies at the graduate level of nursing education required for registration as a nurse practitioner with the College of Registered Nurses of British Columbia? They are self-governing practitioners who work with physicians and other healthcare professionals to provide comprehensive and continuous care for patients. They offer preventative health education and planning that encourages clients to be as healthy as possible and take an active role in healthcare decisions. Thank you everyone for listening, and back to you, Cassidy.
My co-host Ashley and I are here with Lise Dawson, a nurse practitioner from the Nanaimo community. We'll be interviewing her about her experience as a nurse practitioner, the scope of practice in BC, the educational pathway to becoming an NP, and her roles within the community. So thank you, Lise, so much for being on our show. Do you mind telling our listeners a bit about yourself, your background, and how you became a nurse practitioner?
Sure. Thank you. I'm happy to be here. I got into nursing, some might say a little bit later. When I started nursing, I was married. I had 2 children. They were in kindergarten and preschool at the time. I believe I was 31, 32. But at that time, I wanted a career that I knew I could look after myself and my children if anything happened to my husband, and that something was going to keep me interested for the rest of my life. So nursing was high up on the list of what I thought would keep me engaged, and boy, was I right. There are more opportunities for nurses even than when I started. So I graduated from VIU in 2005 with my BSN. After that, I went and worked in Port Alberni. I was commuting out there, working on their general med-surg, palliative, emerge, ICU kind of hospital. It was a really good experience because you got to see absolutely everything. So I did learn a lot with my couple of years there. Then I quickly started becoming interested in specializing. And for me, that was kind of a toss-up between emerge and ICU. And until you kind of are in one or the other, it kind of takes, some people float well between the two. For me, I liked the more organized chaos of the ICU than the chaos of the emerge, but I would go back and forth. So I did my critical care specialty. I worked in the Nanaimo ICU, and while I was there, I started my nurse practitioner education, and I graduated in 2013 with my NP, and I started work with Island Health. I was still with Island Health as a nurse, but I started into my role as a nurse practitioner in February of 2014, which is where I currently still am.
Oh, wow. So you have quite a bit of experience. So how does your scope of practice differ from that of a registered nurse?
Well, there are some overlaps, right? So we both start with, all nurse practitioners start as being registered nurses. So there's overlap. The difference, though, is that as nurse practitioners, we diagnose, we treat, we order prescriptions, we order and interpret diagnostics, we refer to specialists. So as a registered nurse, that's not within the scope of practice of registered nurses.
That's interesting.
Yeah, I think that leads into one of our other questions after. But first, so what are the differences? I know nurse practitioners can work in different settings. So for example, hospitals and communities. So what would be the main differences in working in hospitals versus the community?
So that's a really good question, and it's very long-winded. So we have nurse practitioners in a variety of settings. The programs that we currently have train nurse practitioners to provide primary care. So that is different from tertiary care. So we do have nurse practitioners who are working in tertiary care settings. We have Coco, who works down in Victoria in the cardiac care unit. She's got extra specialty training. We have nurse practitioners in the province who work in palliative care. We have nurse practitioners who work in dialysis and renal. So there are NPs in hospital settings, but the primary number of nurse practitioners is within the community setting, largely within primary care. So unlike physicians, there currently aren't a lot of residency programs. So for nurse practitioners to focus in on a specific area that they're interested in, we don't specialize as physicians per se.
But
there are some opportunities. They're just not, there are opportunities available. It's extra education, extra training, extra stuff.
So do you work in a hospital or community setting?
Community.
Really? How does your scope of practice for nurse practitioners differ from that of a GP?
So this is another complicated question. So nurse practitioners in BC and in Canada all have different scopes of practice. Unlike registered nurses, where everybody graduates with the same scope of practice, nurse practitioners are different. Different provinces have different requirements, and they have different scopes of practice in each province. It's crazy making. BC has the largest scope of practice for nurse practitioners in Canada. We have 2 licensing exams that we have to sit, which is different from the other provinces. We have a written exam that we sit, and we have an OSCE exam, which is a hands-on clinical exam that we have to pass. So the scope of practice in BC for nurse practitioners is large. It is very, very similar to GPs. The lines are very blurred. We come to a similar place of practice through different means. We have our foot and our history in nursing, and physicians come through a different medical model.
Oh, okay.
Yeah, that's a question I've gotten often, and something one of my friends asked me the other day. They asked if there were any medications that nurse practitioners couldn't prescribe that GPs could.
The only one I can think of right now is Adderall for adults.
Okay, so pretty much everything.
Yeah, and it's a hiccup somewhere, and I don't profess to really remember what it is. It used to be when I started, there were more limits and conditions on what we could prescribe. There were some things that we could continue if they were started by a specialist. And then some things that were hands-off, like opioids, benzodiazepines. All of that is now gone. There are very, very few restrictions anymore. And it is up to us to maintain competency in order to be able to prescribe those medications.
Yeah, that's
So
interesting.
extra education. So we all have to take an extra course to be able to prescribe opioids. If you want to prescribe methadone, just like the physicians, there's a methadone prescribing course that you take. For opioid agonist therapy, there's additional education that we take. For PrEP, there's extra education that we take to prescribe PrEP. So yeah, the scope of practice is massive in BC.
Oh, wow.
That's so cool.
Yeah.
So what services do nurse practitioners provide clients, and how would someone go about seeking access to see one?
So nurse practitioners largely are primary care providers. So patients come to me for their diabetes, their blood pressure, their contraception, their anxiety, depression, Parkinson's, you name it. Like, we are the kind of first stop for patients to come and see. If I need to order an x-ray, or if I need them to see a neurologist, or I want them to see a cardiologist, then I do a workup and I refer them on. Mental health addictions. Yep, we do all of that. Counseling. We're not counselors any more than nurses or GPs are counselors. That's not our area of expertise. But as you know, there is an element of counseling that goes into our interactions with patients. Am I a counselor? No. Do I do counseling? Small C counseling, yes. But if people need big C counseling, then again, it's trying to find them how they can access that. And there are some resources around for that.
Yeah, and you can give a referral, right?
So counseling is not something that is covered for people. There are counseling services available in the community. There's crisis counseling, there's mental health and addictions counseling. But for counseling specific stuff, it's people have to pay for it.
Okay, so besides, you did mention that you can't prescribe Adderall. So are there any cases when a client should see a doctor instead of going to an NP clinic?
If you need a specialist. Like I said, the scope of practice in BC is massive.
I did not know that. That's actually,
No.
that's so interesting. And that makes me myself want to become a nurse practitioner.
Yeah, there's some barriers right now through insurance companies. So there's language in contracts that say only a physician can sign this form for this disability or this form for this. So we do run into issues that is sitting at the Ministry of Health and the Canada level, like at the federal level and the provincial levels, to get those barriers. Some of it is contractual language that makes our lives difficult. But that doesn't mean that I can't do it. It's just that they won't accept my signature. So no, I have not encountered things that other than that a GP would be doing that I don't or can't have access or find somebody to do. There's some procedures I don't do, but some GPs don't either. I don't put in IUDs. I just haven't had a need for that in my practice. Lots of NPs do. We don't set bones. Some NPs do. I don't. If you break something, you should go to the emerge and have that set. We do biopsies. I do lesion removals, myoactivation. There's a number of us doing that work. So really the sky's the limit. You can, as much education and training as you want to undertake and practice and hone your skills, there's lots of opportunity.
That's
Pretty
amazing.
much, yeah, anything a GP, like you go to a GP for, you can also go to an NP for, it sounds like. That's something I
Yep.
didn't. Yeah, so as nursing students, this is a bit of a technical question, but we look to practice evidence to guide our nursing decision making. So how do nurse practitioners use evidence in your practice, and how do you stay up to date with the latest advancements and changes in the healthcare industry?
So like RNs, we have practice standards that we have to maintain, right? So we are forever at conferences. So we all attend at least one, if not two conferences per year. There's online educational resources. So we often will do the same stuff that the physicians do. We'll be at the same conferences. We do case review, which is part of our maintaining of our license. So that's with other nurse practitioners. We have scheduled every other month case reviews where you bring cases forward and look for help to support that. There's online resources that we all use.
Well, that's interesting.
Yeah, we're all we have to be up to date.
Yeah, no, I imagine things are always changing, so you want to make sure you're getting the latest of
Yep.
things.
I actually have a question. This is a bit, I haven't written it down, but I'm curious because I know that general practitioners kind of have a time constraint for their patients.
Oh, yeah.
I'm just wondering if you face the same problem.
So the current model of care for GPs is fee for service. So the physicians make more money based on the number of patients that they see. So it is financially advantageous for them to see a patient every 10 minutes. Nurse practitioners are salaried positions. So I don't make more money by seeing more patients. That being said, I need to see a number of patients a day. I book my patients generally anywhere from 20 to 30 minutes. So that does provide me, but that includes my any referrals I need to write, any orders I need to write, and all of my charting is done within 30 minutes. I tend to like to see my patients for about 20 of those minutes. Sometimes that's possible, sometimes that's not, sometimes I'm done sooner. But the current system is kind of going under a bit of a revamping. And the physicians, there are some contracts now that they are being paid a salary as opposed to a fee for service. So there is some change in how care is going to be delivered with attachment numbers attached to that. So you can be on a salary, but you must have 1,000 patients attached to your practice.
Yeah, sorry, I didn't mean to steer off course there.
But no, that makes more sense. I didn't know about the fee, or they get paid more for the amount of patients they see.
Right. It's the fee for service model. So when healthcare, the inception of Medicare in like the 1970s, you've all heard about all that. You've read the Lalonde report, you know, the Ottawa Charter, right? All that stuff go back to year 2. All of that, when they created it, we didn't have the chronic disease that we have now, right? So the ability to go in and have your cough addressed or you fractured your shoulder or whatever was a quick and easy. Now we have complex chronic and mental health illnesses that really are not served well in a 10-minute appointment. So we need to change how we're delivering healthcare, and nurse practitioners are on the forefront of making that happen.
Oh, it's interesting. So what would you say the best part about working as an NP is, in your opinion?
There's lots of good things. So providing longitudinal care to patients is great. So you have a practice, you see patients from cradle to grave, you are involved in aspects of their life, and sometimes in the most terrible times of their life. It's a very privileged position, being a nurse in general, right? We are welcomed in to often the most horrific times in people's lives, but also really positive times in people's lives. I like having autonomy over my own practice. I like having a large scope of practice. I enjoy the challenge. So having to stay up to date, the knowledge that I have to hold and continue to increase, it keeps me hopping.
Yeah, no, I imagine. So kind of on the same note, what would you say the most challenging aspect of working as an NP is?
Probably the politics, right? So coming with our large scope of practice that is similar to that of physicians has created some challenges within those relationships. So it can be a political bit of a hot potato sometimes. Nurse practitioners, we have been around for over 20 years, longer than that, but kind of in BC getting going for the last 20-ish years. And it's been hard to get traction. That being said, with a change in government, there has been certainly a huge notice in the number of nurse practitioners now practicing, the interest in nurse practitioner care, the willingness to allow nurse practitioners to work in primary care, which previous to quite recently was exclusively the domain of physicians. Physicians have always been the gatekeepers to primary care services until quite recently. So there's the growing pains of all of that, trying to figure out where everybody fits. But ultimately, the goal is working together to provide good patient care.
Yeah, because I know there's that big shortage right now with the general practitioners. So I'm sure it'd be helpful to have more nurse practitioners and just that collaboration between the two fields.
That would be lovely. Yes, I agree.
So, how do you see the role of nurse practitioners evolving in the Canadian healthcare system over the next decade?
I continue to see us growing. We now have more vacancies for NPs on Vancouver Island and in BC than ever before. When I started, there were no jobs, nothing. And there are now picks of positions out there that are open to NPs. There's talk about possible residency programs, how that could look. Having more nurse practitioners work in hospital settings, how is that going to look? So I think truly the sky's the limit. You know, the door was open to crack and we've just gone busting right through.
Totally. Yeah, that's amazing. So, what are the steps to becoming a nurse practitioner?
So all nurse practitioners start as registered nurses, right? We all have that. The recommendation is at least 2 years of nursing practice prior to application to a master's program. This is where my advice and pearls comes in. My recommendation is 2 years is maybe not quite enough. That to have a really good nursing knowledge base will put you in good stead for the next stage of your career. Being a nurse practitioner, there is nobody else but you. Your decisions are your decisions, and you need to have a really good foundation upon which you're making your decisions on. So my recommendation is a little more than 2. In order to get into university, you need at least 2 years. The universities in BC are UVic, UBC, and UNBC are the 3 universities that offer the Masters in Nursing.
And the master's itself, is that 2 years?
I think it's 3, 2.5 or 3. It depends how you do it. So I took a course a year around in 3 semesters. So there's 11 courses, or there was 11 courses. So I did a course a year for 3.5 years. Each one course you take as an NP in the master's program is about the workload of 3 undergraduate courses. So I took 2 courses once, twice, and it was so much work. And you're also working, right? So I had 3 kids working in the ICU and taking my master's. So 1 course at a time was plenty, because I said to my husband, oh my God, this is going to kill me. Like, it's a lot of work.
I actually just had a baby. I have a 9-month-old baby girl. And
congratulations, they're so fun.
Thank you. I find it hard
Yeah,
just attending university with her.
Yeah. So keep that in mind. It's absolutely doable. Just be prepared that it is a lot of work. My children talk about the 3 years when mom disappeared. And I really did. I was either working or I was studying. There was hardly any middle ground.
Mm-hmm.
Wow.
And yeah, it's 1 course is like 3 undergraduate courses. And I did mine distance and I thought, okay, I'll be able to fit this in. Absolutely not. It was, instead of like sitting in a classroom, I was just sitting on a virtual platform. I was having to log in. So do it, but just understand what's awaiting and just be in that place where you're like, okay, I can commit to this, knowing that this is what's coming forward.
So at minimum, then nurse practitioners have like 8 to 9 years of school before they actually graduate and get that certification?
Well, you do your 4 years of your undergrad and then 3-ish years. And then I did another 2 years of a specialty. So I had 9.5 years of education.
Oh, wow. So that is pretty comparable to that of a GP year.
It's just a different, a different route, right?
Exactly.
That's a long time to be in school.
That is, but sounds like it's worth it. So
it does. Yeah.
Depends what your goals are, right? What is of interest, what your goals are.
Totally. So do you have any advice for the nursing students or listeners who plan to further their education to become a nurse practitioner? Anything maybe you could think of that you haven't said yet?
Reach out to nurse practitioners in the community, talk to us, ask us. Come to us with those questions. We're all happy to talk about what we do. Come and sit and spend a day. We don't care.
Yeah.
So you know what you're getting into.
I would have never thought to just walk in there and try to talk to you guys.
Why not? Yeah, no, like, you now know how to get in touch with me. You've got my email.
Yeah.
But no, it's an intimidating thing to go about because I feel like there's kind of vague information, especially since it's provincially different on just nurse practitioners and that. I know I was looking into it before this. So yeah, it's definitely easy, or just talking about it, getting the information directly from someone.
Are you members of the NNPBC, student members of the NNPBC?
Yes.
Nurses and nurse practitioners of BC. There's a fee attached to being a student member. Go to their website. It's an excellent resource. I recommend everybody be a member. You have access to so much information, so much learning, and links to other RNs, NPs. It's a great resource. So that would be my advice to nursing students and listeners. Make sure you're members of the NNPBC.
Okay, well, thank you. Is there anything else you want to share with us before we end off here?
I don't think so, other than you don't be worried about reaching out. We're all easygoing people. And we're all happy to talk about our careers, the challenges, the good days, the bad days. Like with anything, everybody, we all started in the same place. And a lot of us got here different routes as well, but we're all happy to talk to you. Don't be intimidated by us. We're the easy ones.
Well, thank you.
My pleasure.
Okay, Lise, well, on behalf of the Sound Constitution, we'd like to thank you for taking the time out of your day to join us, and it's been a pleasure.
Thank you. Pleasure was mine. Good luck with your studies.
Thank you.
Thank you.
Bye.
If you're just tuning in now, you're listening to a Sound Constitution on CHLY 101.7 FM, and that was an interview with Lise Dawson, a nurse practitioner in Nanaimo. Now back to Ashley for some information on how to access nurse practitioner services.
So how can you connect with a nurse practitioner in your community? Nanaimo has recently opened the first primary care clinic on Vancouver Island to be led by nurse practitioners. It's located in South Nanaimo at 1273 Island Highway. The Nexus Primary Care Clinic offers team-based primary care to residents of Nanaimo. This includes attaching approximately 6,800 people to a primary care provider in the next 3 years. The Nexus Primary Care Clinic is a nurse practitioner-led primary care clinic that is owned and operated by the Nexus Patient and Community Care Society. The clinic's nurse practitioners work in collaboration with Island Health registered nurses, social workers, and mental health and substance use clinicians to provide team-based care to families and individuals in Nanaimo. If you are a resident of Nanaimo, you can contact the clinic to see about becoming one of their patients, as this is not a walk-in clinic. You must be a patient before seeing a nurse practitioner. To contact the clinic, call 778-841-0685 for more information. If you are a student of VIU, the Student Health Clinic is another option to connect with a nurse practitioner. The clinic accepts current students of VIU without a local care provider. The Student Health Clinic is staffed by 2 nurse practitioners. The nurse practitioners provide accessible, efficient, and effective healthcare that meets the highest standards of practice. To connect with the student clinic, visit the 3rd floor of Building 200 or call 250-740-6620 for more information. Another beneficial resource for people trying to connect with a primary care provider is Health Connect Registry. It is an online resource for people who are looking for a family physician or nurse practitioner. You register online, and when a practitioner is available, you will be contacted directly. The registry works with an active primary care networks who have the infrastructure in place to help patients find a regular family doctor or nurse practitioner, because we know that having a regular provider leads to better health for you and your family.
Our next segment goes back to Dr. Derek Yak, the Chief Medical Officer at Vitality Group, an organization dedicated to health promotion. Focusing on promoting health globally, Derek Yak describes how a shift in attitude to disease is needed by rethinking our approach to disease prevention within healthcare.
Let's start with a team of vaccination workers traveling up the mountain to a remote village where their goal is to vaccinate the children that have gathered across the mountains. As they are approaching the village, they realize that families are coming from very far away, 3-4 days, to be there just on that one day when they could get vaccinated. But as they're driving up the mountain, a car rolls in front of them. The driver has fractured her femur. She's bleeding to death. If she doesn't get hospital treatment within a few hours, she will die. But if they actually go on to treat her and take her to the hospital, they will not make it in time to vaccinate the children high up in the mountains, and some of those children will go on to get sick and die. What do you do? Our core humanity dictates that we would focus on treating the sick in front of us. Treat the person who's looking at you with her eyes. That is the way we've been trained. And that means that we would not be able to address the long-term needs of the prevention of people who otherwise may get sick in future. I believe that is an unacceptable choice. We need to make prevention of disease and health promotion greater priorities in the way we think about health and healthcare. Let's look at the consequences of that type of thinking. Today, about 95% or more of the budgets of governments and, in fact, of the private sector spent on health are actually focused on treatment and care. Way less than 5% on health prevention issues and promotion. Not surprising that we have Ebola outbreaks in parts of the world where the failure has existed for basic sanitation or healthcare that could have prevented them. Not surprising that people take excess amount of salt and are unable to access decent treatment for blood pressure and go on to suffer from strokes. Not surprising that people are unable to be aware of the importance of smoking cessation, or governments act inadequately to raise the level of tax and they suffer from lung cancer and eventually die. And not surprising that the elderly with frailty go on to earlier and accelerated deaths because of the failure of the nutrition system or the failure even of basic dental health care across their life. The overall impact of this is economic despair at the societal level as well as at the family level. And I believe we need to actually rethink our approach. In the 1920s, a very famous professor at Yale, Charles Winslow, taught his students that the goal of every generation was to redefine the unacceptable and act accordingly. He was talking about our approach to health and the prevention focus. Well, think back to the 1920s. What did we have for health promotion and prevention? We had a fair amount. Smallpox vaccine. We knew about the value then, even of activity. We certainly knew about the value of healthy diets and of hand washing. But today we have a much stronger armamentarium and knowledge base to do even more to promote health, prevent disease, and in fact ensure that we can actually enhance the quality of our life in future. Yet we're still not using all of those tools. In fact, when I was at the World Health Organization, or when I sat in the corporate sector, or a foundation, or academia, I find it extraordinarily difficult to make the case clearly for why we should be doing more about prevention and health promotion. Let's look at some of the issues that hamper our progress. Well, it starts with us. Daniel Kahneman, the well-known economist, behavioral economist, who won the Nobel Prize for his work, taught us that we tend to act irrationally. We tend to make bad choices about our lives. We don't do it because we're ignorant. We do it because we are human. And the kind of decisions we do tend to favor today's short-term rewards over our long-term potential to improve our health. Think about it in your own lives. In the early morning, how many of you on a cold, wintry day will go out to the gym or go for a run or go for a swim? When faced with a spectacular buffet, what are you going to select? And are you going to think at that point about what is in your best long-term interest in maximizing your health? Of course you're not. The society isn't structured to help you think that way. But it also involves our health professionals. Our doctors and nurses and dentists are not trained to focus on prevention and health promotion. The incentive structures really actually encourage them to do that. They are incentivized to actually provide more treatment and care. We know that when a new shiny diagnostic equipment arrives in a hospital, they will happily take it they would never think of allocating the same budget to a new preventive program that may save lives somewhere out in the future. And when a budget is cut in the healthcare system, the first budget to be cut relates to prevention and health promotion, regarded as luxuries, not essential. Of course they are essential. We know that public interest and the media tend to focus far more on an isolated case. It might be a sailor lost at sea, or it might be a child desperately in need of a transplanted organ. That generates passion. It generates enormous investment and money to save that one life, which of course is important. But can you ever imagine the applause for an epidemic averted? Can you imagine the kind of praise that goes out when we're rising the level of life expectancy across the world? Could you imagine a Twitter storm or BBC headlines proclaiming the extraordinary advances that have been made in seeing the declines in heart disease and stroke over the last 15 years? Something, by the way, that is happening. Yet the response of the media is, well, mute. Let's return to the mountain scene and look at it through the eyes of what should be the unacceptable should be the new norm for today. Could this have been avoided? We know that road traffic injuries are entirely preventable. We know that safer cars and safer roads make that possible. We know that in future it should be unacceptable for people to die on the roads. And we know that Sweden, in fact, is leading the way with their goal of reaching 0 deaths on the roads in the next few years. It is possible. Could this have been avoided? Of course it could. It is nowadays unacceptable not to vaccinate children against a wide range of conditions that could potentially harm and kill them. We know that just over the last 15 years, 20 million children's lives have been saved for measles vaccination alone. It should be unacceptable, but it still is happening on a daily basis. But let's think further. The future challenges of the world and the current ones really revolve around a number of big killers: heart disease, cancers, diabetes, lung diseases, driven by just 4 big risk factors: smoking, physical inactivity, unhealthy and excess diets, and, let's be honest, excess alcohol. Those 4 big risk factors and the diseases constitute almost 60% of the burden of disease. Do you think that it is going to be possible to tackle the 1 billion deaths from tobacco alone we're expecting this century in the world using better methods? Yes, it must be. And I believe that the opportunities now of using reduced risk tobacco products offer us unique opportunities to cut the death rate among adult smokers faster than we have ever been able to do before. In fact, I would go further and say that it's unacceptable that we aren't getting behind these new reduced-risk tobacco products faster and more vigorously. That would have a big impact on the number 1 preventable cause of death in the world. But of course, we could be doing more, and we should be. We should be addressing the issues related to the lack of physical activity, the issues related to screening, as well as to healthy diets. We must raise our ambition and voice and prevent the preventable and promote health for all. So, what will it take? First, let's place disease prevention and health promotion at the center of our issues around healthcare. This week is actually the 30th anniversary of the Ottawa Charter on Health Promotion, which was signed in 1986 in Ottawa and coined this very simple phrase, the importance of making the healthy choice the easy choice. The healthy choice, the easy choice. At the time, the interventions mainly spoken about involved government leading the way, and government paternalism was common at that time. More regulations, more taxation, more education would do the trick. But today we're in a new era. People expect to take far greater control of their lives. They do not expect government alone to fix their health problems. We are seeing how millennials are leading the way in demanding that they become a healthier generation, and we're seeing how older people are ensuring that the future generations that follow them are going to be healthier than they are. We're also seeing that technologies and behavioral economics are giving new opportunities to innovate. Think about the innovative insurers, technology companies, and retailers who are starting to think about how we could activate people in their daily lives to make health promotion part of their common way of moving ahead. The second big action we need to take is to try and ensure that we make markets work for prevention. When we think about the private sector and health, most of you would think about the role of the pharmaceutical industry, of medical devices, and of the hospital sector. Their focus, though, is on health care, not so much on health itself. We need to think about what are the companies who are starting to focus on health and putting it central to their business plan. Well, they're coming from unlikely places. They include the wearable industry, the software industry, artificial intelligence, everything including robotics, insurers, healthy food companies, the fitness industry, all coming together to redefine the way we think of health itself and putting it at the center of their business plans. I think in the future, it'll be unacceptable to think about life insurers not actively and aggressively promoting life itself. Why are they called life insurers if they don't do that? Similarly, I think the time has long come for health insurers to put the gainings of health right at the center of their planning and their thinking. Some are starting to do that, but not doing it should be seen as unacceptable. Similarly, it should be seen as unacceptable for retailers and the food industry not to reduce the portion sizes, not to reduce salt, sugar, and fat that may be harmful to health, and be more aggressive in the promotion of healthy foods. It can and is profitable for them to do it. It can and is going to improve the health of the planet. We can do that, and of course, that is coming together at the time when software or the companies you associated with your home appliance manufacturers or your search engines are starting to see they can actually combine in ways to better predict your future health and support you to get onto a pathway of health before you need to address the costs of disease. But to ensure this happens, we need to make sure we hold them accountable to saying what they are going to do. And that requires us making reporting on health more transparent. Just think about it. When you read company reports, you will see they report on their profit and loss. They increasingly are encouraged to report on the environmental impact of their company, to focus on diversity, and to focus on good governance. Not because it's nice to do those things, but because it's material to the long-term growth of the company. So the question is, where's health? The health of employees is one of the most powerful determinants of the morale, the retention, the productivity, and the healthcare costs borne by a company, yet it's ignored virtually. Instead, we focus on plant and machinery, which of course is important, but surely the most important asset in a company are its people. Think about the impact companies have through their products and services on every aspect of our life, how we as consumers, billions of us, every day make a decision on buying or purchasing a product. What is the impact of those products and services on health? Should companies not be starting to report on that? And the more they report on that, the more we, as consumers, would be able to make more informed choices about whether these products and services truly enhance our health or will lead us down the road of continued misery and ill health. I believe the time has come for a greater focus on verification of what companies and governments say they're doing about health before we can start increasing our trust in those very companies. Imagine a world in which the incentives for individuals, for governments, and the private sector are aligned toward that common goal of promoting health and of enhancing the quality of lives as we age. It would be a world in which the acceptable would be the continual stimulation of the vitality and quality of life of people. It would be a world in which doing anything less would be deemed unacceptable. Join me on that journey. Thank you very much.
For those of you just tuning in, you're listening to A Sound Constitution on CHLY 101.7 FM. We just concluded a TED Talk by Dr. Derek Yak talking about the importance of health promotion and preventative care. So how do nurse practitioners contribute to health promotion? Nurse practitioners have the potential to play a significant role in preventative care. Having completed an undergraduate Bachelor's of Science in Nursing prior to their master's, their educational background provides a unique focus on holistic care for individual patients, families, and communities. NPs are trained using the nursing model of patient care, which focuses on the well-being of the whole patient, meaning they do much more than just diagnose and treat health problems. NPs also play an important role in prevention and health promotion across the lifespan. NPs work closely with patients to help them achieve wellness goals and maintain good health. Through one-on-one dialogue, NPs can empower individuals to make better health choices and make lifestyle changes that help prevent chronic disease before it occurs. Although NPs treat existing illnesses, injuries, and chronic conditions, they also work closely with patients to provide education, prevent future health problems, and address lifestyle concerns such as diet, exercise, stress management, and weight loss. And now over to Tyler for a quick fact break.
Did you catch last week's big news in healthcare? Health Minister Adrian Dix announced a plan on April 4th for British Columbia to become the first province to adopt minimum nurse-to-patient staffing ratios in an effort to improve nurses' working conditions and overall patient care. The new nursing ratios that will be implemented are 1 nurse for 1 critical care patient, 1 to 2 for mental health patients, 1 to 3 for specialized care patients, and 4 to 1 for palliative care patients. The standards announced Tuesday will be consistent across all health authorities, reaching all corners of the province. According to the BC Health Ministry, implementation of a standard minimum ratio is a critical component for staff safety, improving nurse retention, and increase access to safe, quality nursing services. Now, back to you, Cassidy.
Thank you, Tyler. The next short 2-minute segment features nurse practitioner Nick Faturer, who practices in New Westminster, BC. Building on the information from our interview, Nick further explains the differences between nurse practitioners, registered nurses, and general practitioners in BC.
A nurse practitioner is someone who has completed their nursing degree, so their bachelor, and then typically after a couple of years of working as an RN, you can apply to take your NP. You're typically required to do a project at the end, and there's some clinical hours, typically with a GP or an NP, where we train additional clinical hours. So we graduate though with a master's degree. Our role is more similar to a doctor than an RN. So it can be quite confusing when we use the same sort of name, nurse. The main thing with RNs and NPs is that when you're an RN, you're not diagnosing, you're not prescribing. It's the focus of our training to function where we can come up with a diagnosis and a couple differentials and exclude the differentials and then treat often with a prescription. I think when NPs first came out, the focus was primary care, and that's kind of where we got started. I mean, that is sort of the backbone of NP practice, I think, and even in the US, where they've been around for over 50 years. NPs will function like GPs, and so you may see a GP who specializes in some aspect of their care, or likewise an NP who specializes in care. So you can see a GP and an NP, but a patient will typically be assigned to one primary care provider. So a typical visit with an NP will be very similar to that of a GP. A patient comes in with a complaint, and you'll take a history, and that's what your GP would do as well.
So because this episode contains information on nurse practitioners, we thought it would be really great to address the GP shortage, which is your general practitioner, nurse practitioner increase, their interprofessional collaboration, and their team-based model. So did you know the number of people without a family doctor in BC has more than doubled from 2003 to 2017? The shortage of family doctors in the province has left a burden on other areas of healthcare, like urgent care centers and emergency rooms. According to a 2023 CBC article, 1 in 5 BC residents didn't have a general practitioner in the latter year. So how can we ensure that everyone in Canada has access to high-quality primary care when there is a growing shortage of family doctors? Part of the answer lies in the team-based primary care. Family doctors and nurse practitioners, also known as NPs, working together with nurses, social workers, pharmacists, dietitians, physiotherapists, and/or other healthcare professionals to care for patients collaboratively. Interprofessional teams are considered a foundational building block for primary care and are endorsed as part of the vision of the patient's medical home model put forth by the College of Family Physicians Canada. Likewise, the Canadian Nurses Association views interprofessional collaboration as critical to improving access to patient-centered healthcare delivery. British Columbia began licensing nurse practitioners in 2005 as part of a primary healthcare reform, and in just 16 years on Vancouver Island, the NP community has grown over 120 NPs, ensuring patients have more access to primary care providers. As of 2022, 74 nurse practitioners were employed by Island Health and are working in a variety of locations around the island. For Canada's healthcare system, which faces long wait times and a shortage of doctors and money, this is a really good thing. The hope is that spending healthcare dollars on more nurse practitioners and incorporating a more team-based model will help bridge the gaps in the system.
Our final short segment today is from the Lippincott Nursing Center, and we'll talk about both the history and ongoing vision of nurse practitioners. While the organization is based in the United States, the information provided is relevant globally.
Hello, my name is Dr. Ann Dapper Woods, and I'm the Chief Nurse of Walters Clore Health Learning Research and Practice. And today I'm happy to bring you a new series called From the Desk of the Chief Nurse. And today I have Lisa Bonzel joining me. She's a nurse practitioner as well as our Senior Clinical Editor for Lippincott Nursing Center. So welcome, Lisa.
Thanks, Anne.
So today we're going to talk about the changing healthcare paradigm and the role of nurse practitioners within the system here in the United States as well as globally. We do know that the biggest challenge we have for any healthcare provider related to healthcare is being able to provide quality healthcare based on evidence that's cost effective. And secondly, to make sure that we can provide access to care to all persons who need it. So Lisa, I want to ask you, with the history of nurse practitioners, how do you think nurse practitioners through their history are well positioned to be leaders in this healthcare system?
Well, thank you, Anne. So over 50 years ago, Dr. Loretta Ford was a public health nurse, and she saw this need in rural communities for healthcare services. So she thought that nurses were well positioned to fill this need and to provide the care. So she thought, let's take nurses, give them a little more education, a little more training, and let them practice independently and reach these people in the community. So she partnered with Dr. Henry Silver and developed the first nurse practitioner program back in 1965. So she integrated this traditional nurse role with advanced medical training, and this new healthcare professional emerged, the nurse practitioner, with a focus on illness prevention and health promotion. So that's kind of a quick history of our profession. Today we know how integral NPs are as part of a healthcare team. In 2010, the Institute of Medicine and the Robert Wood Johnson Foundation released the report on the future of nursing, Leading Change, Advancing Health. At the same time, the Affordable Care Act was coming into play. So there was a lot happening in healthcare. Now, this Future of Nursing report has 4 key messages. First, nurses should practice to the full extent of their education and training. Second, that we need to achieve higher levels of education and training through an improved education system with seamless academic progression. We also should be full partners in healthcare with physicians and other professionals and redesign healthcare in the United States. And we need effective workforce planning and policy making to collect data better and to improve our information infrastructure. So as NPs, we are positioned to make and lead these changes.
I absolutely agree with you. I think that between the Affordable Care Act and the future of nursing, and it's certainly with the changing paradigm of healthcare today, we're really well positioned to have a say and to be there where policies are being made. I don't know if you're familiar, but Walters Clore has recently partnered with the Nurses on Boards Coalition, which is really an interesting group. They started out in 2014 and really spoke to the idea that nurses have to be present where decisions are being made. And that fits with the third tenet of the Future on Nursing report that says we really need to be full partners in healthcare along with physicians and anyone else who's making healthcare decisions. So the Nurses on Board Coalition's whole goal is to get 10,000 nurses at seats at the table on boards by 2020, and that's quite a huge undertaking, but I think it's something that's really going to change the tenor of healthcare as being delivered. I also think, though, nurse practitioners now are having a perfect opportunity to really be the voice of reason in where healthcare is going. And I think it's so important for us to get to know our legislatures and be able to speak to them about healthcare and what are the things going through our Congress right now, what is going to help patients, what isn't going to help patients. And we also need to make sure that we're practicing based upon our full scope of practice. I think that's equally as important. So Lisa, let me just ask you one other question. So based on all these things that are going on with the changes in healthcare, with where nurse practitioners are positioned, do you think the nurse practitioner movement is going to continue to grow, and are we going to continue to be leaders?
Oh, absolutely. We are so well positioned to take on this role, and we have the opportunities. We have the knowledge, we have the skills, we have the background, and it wouldn't make sense for us not to take advantage of this opportunity. We're the ones providing care. We need to be where decisions are being made. So I absolutely agree.
Well, good. So thank you today for joining us. I think it's very clear that both of us agree that nurse practitioners are leaders within the healthcare system, and we will continue to be leaders, and we are well positioned to make our mark on the future of healthcare in the United States and globally. Thank you very much.
Concluding this episode, I would like to give a huge thank you to nurse practitioner Lise Dawson for taking time out of your busy schedule and being a part of our episode. All show notes for today's episode can be found on our social media pages, as well as information regarding future episodes. I'd like to give a huge thank you to our listeners for tuning in to our episode on nurse practitioners. This has been The Sound Constitution on CHLY 101.7 FM, and I hope to catch you all on the next episode.